Cauda Equina syndrome, CES, is a sudden medical emergency where the bundle of nerves at the very bottom of the spinal cord gets squeezed. Imagine the nerves like a small rope of strings that control the bladder, bowel, and the legs. When something presses on that rope, the messages traveling up and down can stop working, which can quickly affect movement and feeling. The most common things that can press on the nerve rope are a big herniated disc, a slipped disc that bulges into the space, a tumor growing near the lower spine, a fracture or severe injury from a fall or car crash, infections or bleeding that fill the space around the nerves. Think of it like a heavy backpack accidentally dropped on the rope, making it hard for the nerves to move. Typical warning signs include sudden sharp low back pain, weakness or a foot drop feeling in one or both legs, numbness in the area that would touch a saddle, the inner thighs, buttocks, and around the genitals, trouble starting to pee, holding urine, or having a bowel accident, changes in sexual feeling. For example, if you try to stand up and your foot feels heavy, or you cannot feel a wet wipe between your legs, these are red flag clues. Doctors first do a quick neurological check testing feeling and movement, and then order an urgent MRI, a kind of detailed photo of the spine. If the scan shows pressure on the nerves, emergency surgery is usually needed within hours to lift the pressure. Sometimes steroids are given to reduce swelling, followed by physical therapy after the operation to help regain strength and control. You can lower your risk by keeping a healthy weight so the spine is not overloaded, using proper lifting technique, bend your knees, keep the load close to your body, and avoid twisting, staying active with core strengthening and flexibility exercises, getting early medical help for any new severe back pain instead of waiting it out. New advances include minimally invasive endoscopic surgery that uses a tiny camera and instruments, leading to smaller cuts and faster recovery. Faster MRI protocols that can be performed in the emergency department, cutting the time to diagnosis. Research into biomarkers, special blood tests, that might one day tell doctors early when the nerves are being damaged,